Hi everyone, so I'm gonna play fortune teller. I am going to predict 10 trends for 2024. You don't wanna miss this. Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're gonna talk about a super timely and super interesting topic. What's gonna happen in 2024? What are some of the trends we're gonna see in the realm of facial rejuvenation? Now, let me preface this by saying facial rejuvenation is basically the subspecialty within plastic surgery that helps people look like a more youthful version of themselves, right? That's the concept, that's what the name implies. For over a century, I mean, we're talking, turn of the 1900s, there's been activity in this realm, and we've seen the field go in so many different directions. I've in fact made an entire video on the history of facelifts and facial rejuvenation, etc., and alluded to many of these things. So we've seen this field change a lot, and frankly, for the better. As we're entering this next year, there's certain things that personally I hope to see, and I think that would benefit the public at large, but I really want to hear what you have to say about this also. So make sure you drop some comments down below at the end. I'd give your opinions. And if you haven't already, folks, make sure you subscribe to the channel, because stuff like this and stuff related to your skin and everything facial rejuvenation is going to be coming to you once a week. Let's not dilly-dally. Let's get right into it. Trend number one is a less filled and more natural look. Folks, we have seen for the last 20 years an explosion of the use of dermal fillers. You've had lots of conversations about this on this channel. I've made several videos on things like pillow face and overfill and this and that, but let me just suffice it to say that I think people are catching on. And what I'm seeing and hearing, and it might be just because of forums like this where you get tons of comments for people who can share their own experiences, but we're seeing that people are starting to catch on that, guess what? You can't defy gravity. You can't fill a face and lift a face at the same time. There is definitely changes that are happening related to volume loss, but those are subtle changes, and that the days of packing in filler into the cheeks and packing in filler into the jawline hopefully will be behind us as we trend forward to a more natural approach to facial volume and fillers. And let me just say this, I'm not against them. In fact, they're a great tool for certain problems, but if you use them incorrectly, it's a bad outcome. The stuff doesn't go away, it builds on itself, the face starts to remodel in a completely different look. Now you've got aging on top of like a really full looking face, and frankly, there's not much that can be done once you've crossed that line and it's there. So trend in that direction, 100% we want to see it. Who is with me on that? Trend number two that we would like to see, keeping our facial fat. Now, what does that mean? Remember, we're losing facial fat as we age in certain areas, specifically areas like under the eyes, the temples, above the eyes, around the mouth. These are areas that are kind of constricting as time goes on. But for years, people have been doing things to age a person, not on purpose. Obviously, no one would do that on purpose. It's just the wrong paradigm. And this happens time and time again in medicine. In fact, I should do a whole video on all the times we've been wrong about concepts and ideas and things that we thought were good and bad, etc. But one of them is the removal of facial fat in the realm of facial plastic surgery and facial rejuvenation. What are some examples? Well, I'll start with this. Liposuction. Going under the neck and liposuctioning the neck. Folks, there is a soft and important layer of fat underneath the neck that gives the neck a sensual, youthful, very elegant look. When you stick a liposuction cannula in there and you're trying to remove it to contour the neck, what you're removing is subcutaneous fat. That's the fat between the skin and the muscle layer. That is exactly the fat you want to keep, because that's exactly the kind of fat that makes the neck look pretty and soft and natural. And by the way, as you age, we shed some of that fat, we lose it. That's where the necks become very thin, crepey. You can see every little muscle, etc., in a certain type of neck anatomy. Last thing you want to do is exacerbate it. Another example is there's a ton of techniques for upper blepharoplasty that removed upper eyelid fat. Folks, when you remove upper eyelid fat, you're effectively aging the eye. We know that naturally we lose this suborbital fat underneath the bone here, So if that fat is being diminished as age and you go in here and remove that, guess what you're gonna do? You're gonna make the eyes look more hollow, you're gonna make it look more gaunt, you're actually gonna make it look aged. This was a whole technique. I mean, if you went in for a blepharoplasty, this is what you're getting. Still today, people are doing it. It's a mistake. You don't wanna remove fat from the upper eyelid region. Another example is the buccal fat pads. Buccal fat pads are these fat pads in the cheek. You know, there's this whole notion, this cosmetic notion that it's good to look like this. Not a good look, trust me. It doesn't look good on me when I just did it right there. It doesn't look good on anyone to lose that. Now, there's some people who really have a large buccal fat pad. There might be some advantage for them to remove it, but you lose the facial fat pad. You know, with age, that area begins to get more gaunt. You take it out when you're in your 20s and 30s, you're gonna end up with a skeletonized, bony looking face, and you're gonna regret it because there's no way to put fat back into the buccal compartment. So you're kind of hosed in that situation. There's a number of other scenarios where you're losing facial fat. People have been liposuctioning the jawline to try to remove jowls. I mean, jowling is a laxity issue. It's the facial fascia coming down. You try liposuctioning that, you're just liposuctioning again, facial fat. What happens when you lift the face back up into position? Well, guess what? There's a deformity, there's a dent in that area. Stay away from removing a facial fat. Now, sometimes you do it inadvertently. I've just named a number of surgical procedures that are like actually trying to remove facial fat, but there's a number of non-surgical things that inadvertently remove it, and I've mentioned them on this channel many times. That's things like deep radiofrequency microneedling, things that are going in the 4 to 6, 7, 8 millimeter range. That's getting right into the subcutaneous fat. Same thing with all therapy and those non-surgical energy devices. To summarize, keep your facial fat as long as you possibly can. And then when the time comes when you actually lose a little bit, go get a fat transfer, add a little bit of filler here and there to support those specific areas. But don't, especially if you're young, folks, do not go in there and remove these very, very important fat pads. In fact, the lower eyelid fat pad can also be removed as part of a blepharoplasty, but when I remove them, and you've seen this video before, when I remove the lower eyelid fat pad, I always add a little bit of volume around it. So it's a kind of like you're removing a little bit above the bone and you're adding volume below it, so you get a beautiful transition. If you just remove lower eyelid fat pad, like as a lower eyelid blepharoplasty without adding fat, your eyes are gonna look gaunt and tired. It's not gonna look more youthful and fresh. You won't have the bag there, but you'll still look gaunt and tired. If you haven't watched that video on eye rejuvenation, make sure you do. But this is a trend that I hope to continue to see moving in this direction. Less liposuction, less removal of fat, more preservation. Leave the face alone. Number 3, natural looking surgical results. 100% folks, we're trending in the right direction here. I'm not gonna pat myself on the back, but I'm just gonna state a fact that my entire surgical success, the reason why patients travel literally from all over the world, and I have a schedule that's filled out 8 months to a year of facial rejuvenation procedures, vertical restore, etc. The main reason it's been like this for the last 20 years of my practice is because I've learned and been able to execute and create a natural looking outcome. People want to look natural. People don't want to look pulled, they don't want to look tight, they don't want to look like they look like a different person. They want to just walk into a room and no one to tell that they've had work done. There's a lot of effort and energy, and quite frankly, just through the power of social media, I mean, when I put up before and afters and it's seen by like this large audience, and patients want that, they're gonna push their surgeons in communities and all over the place to try to create more natural looking outcomes, because that's what the consumer wants. And at the end of the day, surgeons will respond. And I'm sure as we begin to refine and correct our surgical treatments, again, paradigms. I mean, for years, the idea was you pull a face sideways to tighten it up, but guess what? You've taken the mouth and pulled it halfway across the cheek and made the person look like an alien. And yeah, the jowls are gone, but can't really say they look better or younger. And certainly they don't look non-operated, because the second they walk into any room, every single person in that room knows immediately this person has had work done. And I'm sure you all have seen this time and time again. So let's trend in this particular direction. Again, this has been the magic dust of my entire practice, and this is the reason why I think I have been as successful as a surgeon as I have been, because I've cracked the code on keeping people looking totally natural. Number 4, comprehensive, balanced surgical outcomes. So what does this mean? When the face ages, it is rarely an isolated event. There's a number of different things that are aging at the same time. On one hand, there's things that sag, there's volume loss, there's changes to the skin. You've heard me talk about the 3 sort of pillars of facial aging and the 3 pillars that you need to correct the face with. You need to treat the skin, you need to treat the volume, you need to treat the sagging. But if you break down sagging and even volume, there's subunits involved. There's sagging in the upper lids, there's sagging in the lower lids, there's sagging in the corners of the brow, the midface, the jawline, the neck. There's a top lip that starts to sag. And guess what? If you go in and you say, hey, I want a lower facelift because I don't like my jowls and I don't like my neck. Okay, so tighten this area. Well, guess what? You tighten this area up, everything else around it looks aged. What do you think you're gonna look like? You're gonna look like something has been done to you. Why? Because when you're younger, from top to bottom, the entire facial subunits, they're all younger looking. When you age, every one of the subunits that I just mentioned, they all start to have signs of aging. When you go in and you treat 1 or 2 of these subunits at a time, guess what you've done? You have created a look that doesn't exist in nature. It doesn't exist when you're younger, it doesn't exist when you're older, and when something doesn't look like it belongs in nature, guess what? Immediately, people can tell something's been done. It just looks weird. The whole concept is weird. A comprehensive approach is the only approach. If you're not ready for it, then just don't do anything. But don't go in there and piecemeal the face. And frankly, another one of those like 20-year philosophies, this has been my paradigm. I mean, I was talking about doing this stuff before it was even fashionable, frankly, before even people understood. Like they would go down the street and somebody would, tell them, hey, you can have a neck lift. And they would come to me and it would be like, you need a face, a neck, you need the lateral brows, you need a fat transfer. And the person would walk out saying, what in the world? You're saying all these things, but why did that person just say one thing? Well, because they were wrong. Because they were wrong. Frankly, they were wrong in their approach, and that never changed my passion and recognition that this is the way to do it, and I just stayed with it. You want to book with me, book with me. You don't want to book with me, don't book with me. But if we're going to do it, we're going to do it right. And this is something that I want you to really understand. Comprehensive is the way, back to the previous point, to a more natural looking outcome and a far more balanced and attractive overall look. Number 5, for Christ's sakes, less energy devices. We all have to learn from our mistakes, and we all have to open our eyes when something isn't working. I mean, what's that definition of insanity? It's like you do the same thing over and over again with the same result, right? Same negative result. Well, that's the idea with these energy devices. And I've done a number of different videos about it. I've spent a lot of time on Instagram and things. The public outpour of their own stories, the public support for each other is always the same. Oh, I've done this treatment. It's either made things worse or didn't do anything at all. It was expensive, it was painful, da, 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 da. Guys, there's no room. I'm just gonna say this straight. This is my opinion, take it or leave it. There is no place for energy devices to tighten and lift the face. I didn't say that about fillers, did I? I said there's a place for doing them the right way, in subtle ways in specific areas. There's quite frankly no place for things like Morpheus 8, Ultherapy, Thermage. I mean, there's a billion different names, brands for this concept. The whole category is a bill of goods. It doesn't exist. It doesn't do anything really positive. And quite frankly, same goes for thread lifts. You've heard me say it before. This is another one of those aspects that really just trend this, let's go this direction, right? Because we've certainly seen the peak of it. We've certainly seen that, and people are catching on again, just like down, 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 down. Lots of people realize about this, speak about it, and once you do that, word gets out, less people want to do it. 2024 trend away from energy devices and thread lifts. Number 6 is one that I'm extremely passionate about. Fundamentally, what makes a person look old? It's a combination of changes in the skin, and there's changes that are happening to the shape. Well, I already alluded to the shape, and we're going to talk more about that as we get a little lower here in the list. But as far as the skin goes, the trend that I would like to see, and the trend that I am seeing, is that more and more people are realizing that the name of the game when it comes to skin is stimulating collagen. Why is this so important? Because the skin, starting around 27, starts to lose collagen. You start to go downward in the trend. I mean, you're literally losing the thickness of the skin as the years go by. So then what ultimately happens is you get to perimenopause and menopause, and then estrogen drops, and then you take a real nosedive from collagen. That's when the skin really starts to show its age, right? But what's fascinating is you can actually do things to counter this, to defy this, by bypassing the natural, sort of genetic aging that happens to skin by turning on the cells that stimulate collagen, the fibroblasts, the cells that make melanin and pigment. You can decrease them. This is in the category of active skincare. In addition to active skincare, there's also collagen stimulating treatments. So let's break it down. So I've done a number of videos on this and speak very passionately, partly because I realized how important this part is, and I went out and literally developed an entire skincare line that focuses on this and makes it really, really easy. That's the Karam MD trifecta. It makes the entire process super easy. But what is it about this that's so important? Well, things like retinol, things like vitamin C, things like niacinamide, things like growth factors, non-hydroquinone botanical lighteners, these are all actives. What they're doing is they're stimulating collagen, decreasing pigmentation, making the skin younger and younger and younger and younger, literally with each day of use. I mean, it's just that simple. I mean, you don't believe me? Look at somebody who's in their 70s who has amazing skin. Ask them, what have you done for your skin? The answer will always be the same. I've been incredibly diligent with sun protection, which is pretty amazing for a 70-year-old today because they went through that whole era when everyone was sunbathing. And then two, they've been on some active skincare component for the last 40 plus years. It's always the same, every single time. So the bottom line is active skincare ingredients and the use of them in a diligent and very committed way is the only way towards better skin, period. Let's just make that very clear. Then you can augment and enhance that with things like microneedling, things like light chemical peels, etc., things that are going to stimulate collagen, and you do those, once a quarter. But in between that period of time, that skin is getting the signals from these different components, these different active ingredients, to keep that process going, to keep that collagen being stimulated. And instead of the curve going like this, the curve is going to start to ride like this. And if you happen to be young enough to be watching this, instead of your skin even going like this, if you start that stuff early, your skin's just gonna literally look like this. You're gonna have 30-year-old skin your whole life. It's a fact. There's no question about it. Sun protection combined with actives, it's amazing. I see it every day in my practice. I see it every day with my patients, consultations, surgeries, and on the skincare side, I mean, patients, customers, thousands of them who tell us their stories about not only how trifecta has changed their skin and they've been using it for a year or two, but also how those who've had great skin and just switched to the trifecta because they just wanted something simpler, but had been doing this their whole life, how much of a believers they are. So just take what I'm saying and trust it. Go get your social proof where you need to get it, but believe me, this is the way to flow. Okay, number 7. This is one that's near and dear to me. Less stigma towards facial rejuvenation procedures. Folks, it's much deeper, much more important than gels and neck laxity and looseness around the eyes, etc. When we age, we stop looking like ourselves. We literally stop looking like ourselves. I mean, anyone who's watching this, who's in their 50s and above, knows this near and dear to their heart. You literally stop looking like yourself. And with each year that goes by, you look like yourself less and less. It doesn't have anything to do with vanity. It just has to do with desiring to appear on the outside the way you feel on the inside and the way you picture yourself. Trouble is, if you're healthy and you're taking good care of yourself, etc., you could be 80 and still feel 30 on the inside. And I guarantee you, if you close your eyes right now and tell me how old you feel you are, right? How old do you feel? I'm 50, I feel 30. I'll be 60, I'll guarantee you I'll still feel 30. And if you're in that age range and above, whatever, you're gonna probably be somewhere in your 30s, maybe even in your 20s. But your face starts to go the other way. Pictures are taken, videos are taken, you're like, wait a minute, who is that person? You stop wanting to take photos, you stop wanting to be in videos, you start to feel, uncomfortable in your own skin. That's the reason why somebody gets these procedures. They should not be judged, is my point. You should not feel that people are judging you because they think that you're being superficial or vain, because it has nothing to do with vanity. You're not doing it for your husband. You're not doing it for your friends. You're not doing it to, get boyfriends or girlfriends or whatever it is. You're doing it because you want to feel like yourself. Same reason why you might dye your hair, same reason why you might fix, cracked tooth that you're living with. The same reason why you take good care of your body and try to stay in good shape, because you want everything to kind of be in line with the way you see yourself. Facial rejuvenation is not cosmetic. Facial rejuvenation is restorative. It's about aligning the way you look and the way you feel. And this is why I start off every conversation by saying, this is really about looking as young as you feel. Are you guys with me? Drop it in the comments if you are. So in conclusion on that topic, first of all, grateful for all of my patients who literally put themselves out there on social media and share their before and afters. I mean, we got literally hundreds and hundreds of people who share. They're doing it for you. They're literally doing it for you. They're not doing it for me. They're doing it for you because they want to help the next generation. People feel comfortable with the decision to take care of themselves. We had a patient speaking to us about how when she's 70, finally decided to get over her insecurity issue, like where everyone would judge her, and finally did the procedure and was so grateful that she managed to get it. And now she's like out there advocating for other women to feel more comfortable with this decision. All right, number 8. If you want to get something like this done, believe me, I'm not saying you have to get it done with me, because obviously I only can operate so many times a month. It's less than 30 times a month. And there's a lot of you out there, obviously, right? So I'm not the surgeon for every single person, but there is a surgeon for you. What you need to do is be willing, when the time comes to do your facial rejuvenation procedure, to put in the time, to put in the research, to find that surgeon wherever they are in the country, right? Frankly, I mean, 80 or 90% of my patients are traveling in from surgery from literally all over the country and even outside of the US. I mean, literally just moments before I shot this video, I was talking to a patient from Singapore. It's your face. You don't have that many chances of getting it right. So if you find a surgeon who creates a natural look for you, who creates the aesthetic that you're looking for, can do it reliably, has the experience, and I did, again, an entire video on how to find the right surgeon, but really it just simply comes down to making sure they have the knowledge and experience, they do this all the time, they're specialized in it, they create the look that you're looking for, and then once you do, and obviously you have to be within each other's price range, etc., but once you do, and they happen to be across the country, happen to be in the next state over, whatever it is, travel. Be willing to travel for this, because literally, if you get it right, you should be done with this for like 10 to 20 years. If you don't get it right, you'll be right back needing a revision or something. Not only is it significantly more expensive to do 2 surgeries over 1, but you'll be disappointed, you'll be bummed, and all that other stuff that goes along with it. So make sure that your expectations are met by expressing them, and also looking for a surgeon that aligns with your expectations, and talk to them. Explain to them what you're exactly looking for, and assuming they have integrity and whatever. Like when a patient comes to me and says, oh, I want perfection, I want this and that, that's not my patient. The patient I want is one that simply wants to look like they used to, that wants to get out of this thing not looking like they've had any work done, look completely natural, look a lot better, look completely natural. We put those two together, we're in the top 1% of surgical outcomes that you can have. That's my patient. But those patients who are hyper, looking for perfection and this and that, those are the patients that are gonna run themselves off the road, and I don't want any part of that, right? So I'll be very clear with somebody when they express that that's the look that they're looking for. I want for you to be willing to go out, search for the doctor, and get there. So this is not the same as medical tourism, because I'm not a big fan of you leaving the country because somebody's cheaper in, I don't know, South America, Turkey, wherever, because look, at the end of the day, cost is definitely a factor, but it's better not to do anything than do something risky. And I'm not saying the surgeons outside the US are risky. There's amazing surgeons out there, but all of us, including myself, have the potential to have a patient have surgery and have a medical related problem. If you have a medical related problem, infection, hematoma, God forbid, some drug related anesthetic complication, etc., something like that were to happen and you don't have a good medical system to rely on, it's very, very problematic and very scary. I've heard some horror stories, obviously I'm sure you have as well. So just recognize, I'm not suggesting leave anywhere. Price is the last reason why you should leave. If you find the surgeon that fits everything that you're looking for and happens to be outside this country, then that's great. Just think about, the worst case scenario and understand that you have a plan there. If you do, then you're all good. But within the country, usually we have, hospitals and medical systems that take your insurance, et cetera, that could be handy if something were to go wrong. So travel for the right surgeon. Don't take unnecessary risks. Number 9, I kind of alluded to a moment ago, but it's realistic expectations. Folks, surgeons aren't miracle workers. They're not God. They're not, capable of overcoming anatomy, right? So let's start with a realistic expectation. Let's have an expectation that is able to be met, because at the end of the day, folks, I'm telling you this, the whole point of doing any of this is for you to be liberated of the thoughts and the awareness of the aging process. If after a really successful outcome, you're still fixated on this or that, the other thing, it's gonna not only ruin the outcome for you emotionally, you will get nothing out of it, but you're probably gonna drive your surgeon crazy, and you're probably gonna seek revisionary work, and as a result, you're gonna, like I said earlier, you're gonna run yourself off the road. That's a big reason why people get really messed up after these type of surgeries, because they keep chasing these small things that literally don't amount to anything. So big picture, realistic expectations, be happy with a safe, proper outcome. Save yourself, save your surgeon, a lot of heartache, and be grateful for being able to gift yourself this type of procedure, but also help yourself be happy with the outcome, right? So again, set those expectations up front. Surgeon should be realistic with you, then you should accept them and go forward with the procedure. Which leads us to the last one, number 10. This is a trend that I'd love to see, and I'm probably gonna have to lead this a little bit through all this videos and social media stuff. But as a surgeon, one of the best advice I got when I was younger was just look at faces. Wherever you go, just look at faces. I probably look like a weirdo because I'm literally staring at people's faces wherever I'm at, airport, restaurants, this, that, in a line, whatever. I'm always looking at faces, because looking at faces of all ages, of all ethnicities, of sexes, this and that, gives you an idea of what's normal. So know what youthful anatomy looks like so that you can appreciate the changes that happen once that normal youthful anatomy is restored, and you're not thinking in this sort of like clouded and misdirected way that our industry, our marketing and all the other things have done. So what are those examples? So basically it comes down to like this. So do you remember when fillers first started? Everyone, it was like public enemy number 1 was the nasolabial fold. It cannot exist on a human face. I swear I'm not kidding. The trials for these fillers were 3.6 cc's of filler in each nasolabial fold. That's 7 fillers between the 2 nasolabial folds to show that, quote unquote, the filler worked, right? I mean, that's a lot of filler. These are the Voluma trials, I believe, when they first came out, to show that, after a year or two, whatever, a lot of filler goes into these things because you're not supposed to have a nasolabial fold. Guess what? Human beings of all ages have varying levels of nasolabial folds. It is true that as the midface starts to droop, the nasolabial fold gets deeper, but its existence has always been there. So you as a patient should not wish that your nasolabial fold goes away. But we've kind of created that idea in your mind, and unfortunately, there's no way out of it. You just have to accept the fact that a nasolabial fold is a normal part of the face. And I'm kind of messing around here, but it's the truth. I mean, I've had some hard conversations with people, beautiful outcome. I mean, the person looks literally 15, 20 years younger, but they have a nasolabial fold. And they're like, wait a minute, doc, I thought you were supposed to get rid of my nasolabial fold. I'm like, wherever have I talked about a nasolabial fold vanishing as a result of the surgery? I've never even used that terminology or words. I would never dare, because such a thing is ludicrous. However, you can soften a nasolabial fold by lifting the depressed cheek off of the nasolabial fold, but you're not going to get rid of it. No matter how much filler you put in it, it's just not going to happen. Another example, tear troughs. I have spent so much time, because I've got kids who are in their teens and early 20s, and tons of their friends and colleges that I visit, etc. I'm looking at a lot of 20-something-year-olds these days. I'm blown away how many of them have a little bit of a tear trough, meaning that little bit of depression under the eyes, a flat midface. Guess what? For years, almost 2 decades, we have been, piling Restylane into tear troughs, putting filler into cheek. Why? To get rid of this, because we're supposed to no one's supposed to have a tear trough. No one's supposed to have a hollow here. No one's supposed to have a flat cheek. You're supposed to have a big apple, sitting in your cheek. No, that's wrong. That's not the way the face is supposed to be. In fact, these younger patients, they don't look 50, they don't look 80, they don't look 100, they look like 20-year-olds, and they have these. So the bottom line is this, again, speaks to a lot of our misconceptions about anatomy. So things like tear troughs, things like nasolabial folds. What makes a person look younger? Again, I'm gonna remind you, what makes a person look younger is a young-looking facial shape, which is basically like a V, tight jawline, firm neck, and young-looking skin. Show me a 20-year-old, 30-year-old, 20-year-old, whatever, who doesn't have those two qualities. Youthful, supple, clear-looking skin, and a firm jawline and neck. If they don't have those things, they don't look 20. They could have a little hollowing, they could have a little bit of temple, the temple could be a little hollow, etc. All these things, they're still gonna look 20. Volume doesn't make a person look older. It might make them look a little tired. It's not gonna make them look older. These are important anatomic things that I'm hopeful through more education and videos like this and social media stuff that I'm gonna start to plant the seeds and people start to become more realistic with themselves and the expectations of the procedures that they're gonna have. So ultimately we can go back full circle, which is my #1 wish and trend that I'd love to see as a more natural looking outcome. I'm frankly tired of seeing people look like, cartoon caricatures and aliens and avatars and whatever you want to call me. It's just a shame to do that to a human face. I didn't go into facial rejuvenation surgery. I didn't go into becoming a facial plastic surgery to do that to people. And I can pridefully say that I haven't done that to people in my entire career. I've managed to stay away from the trends that have created those effects, and I've managed to stay put on the things that create natural looking outcomes, which full circle is what it's all about. All right, folks, that was 10 2024 facial rejuvenation trends that I'd love to see, that I feel like we're heading in that direction. People want to look as young as they feel. They're gonna seek these treatments. Let's figure out how to do these things globally, nationally, whatever, in the right way so people don't. But guess what? It starts with you. Because if you know what's right and wrong, and if you know what should be done and shouldn't be done, you're not gonna walk into a medical spa, dermatology office, plastic surgery office, and be told what to do and naively accept that. You're gonna know, again, after watching this video, a lot more than, trust me, a lot of injectors, a lot of practitioners out there. You're gonna be in a much better position to basically navigate the direction. So make sure you share this with some friends and family. Again, if you haven't already, hit subscribe. If you love this kind of stuff, follow my newsletter, Karam MD Journal. Again, once a week, I write this thing for you guys to bring knowledge and awareness over matters related to skin. If you enjoyed this, make sure you like it, and any questions and comments, drop them below. I love reading and seeing what you guys have to say, and I actually, really do my best to try to answer as many of them as possible. All right, folks, that's a wrap. I hope you enjoyed it. Until next time, Dr. Amir Karam.